Good afternoon, and thanks so much for joining us for today's Salty Dog webinar. This is Barb Tyson, and with us today we have Bennett Kashdan and a great team who will be sharing information on some of the medical and evacuation services and resources available to offshore cruisers. Real quick, remember to keep muted, keep video off, but if you have any questions or comments, go ahead and type them in the chat box. And with that, I'll hand things over to Alex Helfand, our Salty Dog Education Coordinator.
Thanks, Barb, and welcome everybody to today's second webinar on medical related matters. This one was very important to me personally, only in that I think so far I've had two incidents where in one case we used offshore services, and in the other one I created my own. And in both cases, it was great to be able to talk to somebody and get some advice on what to do. We also realized, at least I realized in the second case, even in the first instance, we didn't necessarily have everything on board that we needed. So I think some of what we're going to talk about today in terms of how you prepare your boat's kit is really relevant. So I'm going to turn this over to Bennett, who's going to basically moderate the event. And as we said before, please use the chat box to put your questions in. All questions are worth asking. And with that, Bennett, it's all yours.
Okay, Alex, you can hear me and see my title slide?
Yep, you're good.
Okay, awesome, great. Hi, everybody, and welcome. So, this is a big topic, medicine while on passage and while abroad. And if you sort of see where we've come so far on this over years, the what's your medical plan kind of question. The challenge is dealing with health issues in both places, on the water and on a passage and in a foreign country. So there's a bunch of information. There's information in the SDSA website about things. Comprehensive first aid kit is recommended, a ditch bag, the advice to meet with your doctor to prepare a medical kit and understand the requirements. All that is mentioned, and historically it's sound advice. There's even a nice list of meds that somebody else put together years back that makes a lot of sense. A few weeks back, we had Jeff Finkelstein do a really good presentation of just meat and potatoes, marine related medicine to whet your appetite for getting knowledgeable and for trying to start this the quest of what information, what supplies do you really need. And then a few years ago I explored some services that appeared in this document called What's Your Medical Plan, which is somewhere on the website. But the point was that I tried to get a few services together that were adjunctive. So we talked about understanding your health insurance plan when you go abroad, standard stuff, what does Medicare not cover, which is they don't cover a lot. Your private plans abroad, that sort of thing. You have to know those things. Then repatriation programs, we got MedJet and DanBoater involved. They're sponsors, and Ursula Hash is here from DanBoater to talk with us today. We started conversations about telemedicine, and then COVID came along, and the world changed instantly. So while telemedicine became amazingly popular and utilized greatly during the pandemic, we were sidelined from it because we had well, I'll say personally, I felt like the world was doing this, and to get pleasure boaters in on a telemed program just didn't seem quite correct at the time. So we kind of put that aside. But in the background, Maritime Medical Access is a George Washington University program that we started a dialogue pre-COVID, and we resurrected it a few months back because we're very excited to try to get a relevant telemedicine program available for people like us and an affordable program. And then that's where we left it up until recently. I tried to get back to normal business. The normal business is how do we start thinking about filling these holes in our medical plans? What are the holes? Medical kits, for example. What do people's medical kits really look like? Does yours look like this one? John Tausig is here from Backcountry Medical Guides. And Benjamin Jack is here. He's the founder and CEO of Duration Health. And they'll discuss a functional medical kit, including prescription drugs. And it's also a good time to mention that we just got another new sponsor that I know John is familiar with. MyMedic is an actual supplier of offshore medical kits. So we can talk about what makes a good medical kit. These guys are all featured in the new sponsor section, by the way. So what do I do with this medical kit? Does your medical kit prescription bag look like this? I just cleaned mine out. Mine looks like this. And I got medicines while I still had my license. I haven't had my license for a few years now. So I had to throw it all out. I bet you do too. So you have courses that you're going to take. You have guidebooks that you've read. You have YouTube videos that you could watch. You have sat phones, SSB. You have crew that might be doctor, nurse, paramedics, whatever. But how do you really institute a good plan? And I can tell you, just like Alex said, I've had more than my share of events that happened to know that even as a retired physician, I was a radiologist, by the way. So, you know, I wasn't exactly the prescriber of the year. I can read you a CAT scan on mid-passage, but I don't know which antibiotic to pick for what you have. So this is not easy stuff. And Adam is going to help us with that as is John. So we have a great group that's about to talk to us. So the I need help section is we have all these resources. We know about all these resources, and shout out to the SDSA Shoreside team. They do a tremendous job. But one of the things that I want to work with Tim on is to hone the medical side of the Shoreside team. It's pretty clear that it's not optimal when you actually have a situation. Who do you talk to? We have these problems where the Shoreside team talks to the PMD at 2 in the morning. Do you know what it's like getting a PMD at 2 in the morning? Especially for somebody who's got a problem 2,000 miles away in a 40-foot sailboat. This is not optimal. So this is going to be a very exciting talk, I think. How do we get people home? There's no water taxi for you in the middle of the ocean or in a foreign country. So that's kind of it for my intro. And I'm going to hand it over to, I think John Tausig is going to go first. John, are you up?
I can go. Yeah, I'm.
Yeah,
ready.
John, you're up. John
Terrific.
Tausig, ladies and gentlemen.
Well, thanks. I'm hailing in from a fire station in on Chuckanut Road in Bellingham, Washington right now, if anyone's familiar. But
Yeah.
I really appreciate being here. I just wanted to touch base on a few things. I'm going to try to do a screen share. This will stop other screens from sharing. Continue. Okay. Yeah, as might have mentioned, I am the executive director for Maritime Medical Guides and Backcountry Medical Guides, two separate brands within one central nonprofit. And we teach a lot of different remote wilderness and maritime medical programs, mostly out here on the West Coast. Now, I do want to talk specifically about some of the different layers of training that are available. And let's see here. Can you still see my screen? There we go.
Yeah.
Okay, so, in looking at first aid kits, there's a lot of things to consider. So, what are the group capabilities? What are, the trip itinerary and common emergencies? There's been a lot of really good research that has gone into identifying some of this stuff, particularly on ocean races and transatlantic passages, and it's been published. And there's some really, really good epidemiology studies on prevalence of injury. And so most people might already realize what the most common thing is. Of course, everyone thinks it's going to be an accidental jibe that hits you in the head, but it's much more benign than that. It's lower extremity soft tissue injury, also commonly known as the boat bite. And it's the bruising, the smaller, more benign injuries that can actually get, terribly infected and become life-threatening if you don't address them. So looking back at some other common principles, get to know the members of your group. Not only their medical history, but you want to know what their comfort levels are, and any kind of recent injuries that they might have had. A lot of people leave musculoskeletal stuff off of their medical history. I'll give you an example. Leaving Seattle, sailing down to California, get on the boat and push off the dock, and my dad mentions that he rolled his ankle the day before, but it wasn't part of a history. It was a recent history. And so, you really got to know who's on the trip with you. Make sure that the trip is appropriate for everyone that's on the group. And then some people say to allow each person to carry a personal kit. Others like to keep it with less autonomy and more full disclosure for the whole group. But having, sunscreen available to a certain extent, ibuprofen or some minor bandaging might be a nice touch. Understanding the equipment is the next part, and you can buy the most expensive kit on the market and get a lot of equipment that is going to either confuse you, you can hurt someone with, or you just don't know how to use it. Now, in the boating context, it doesn't matter if you don't know how to use it. I once upon a time kicked a surfboard skeg on deck in Nicaragua, having sailed down there, and found a physician that was able to use my sutures on my foot in the anchorage. But I don't do a lot of suturing, and I wouldn't necessarily want me suturing me, particularly if I had a facial laceration. But I still have that equipment. So that's kind of one of those things where understanding the equipment and your own limitations is important. Bring multi-use materials, and if you elect to omit anything, like say on a shore trip or on a dinghy ride, make sure that you have a good plan of how to improvise it. Things like tourniquets would be a perfect example. I don't have a tourniquet on me right now, but I do know if someone was bleeding, I could fashion one really quickly because I have a good plan. Now, in terms of the members of your group, there's a whole slew of different medical certifications that it could be. It could be a, I got trained in CPR, that's 6 hours. It could be a wilderness first aid 18-hour program. Once you start trickling up into wilderness first responder, now you have given the time to really practice a lot of the skills and scenarios. EMTs, paramedics are great providers. I'm biased because I've been a paramedic for 20 years, but they have really good field relation and do first response really well. When you get into the nurse, physician assistant, nurse practitioner, now you've got some advanced skills that might have more experience with advanced types of prescription medications. And then of course, everyone wants a doctor or DO on board with them, even though, again, the bias comes out, even though sometimes the most appropriate first responder is someone who works in the first response sphere, like a paramedic. That being said, you can read and see all this stuff on YouTube, and there's people, putting in chest tubes and so forth and so on. I don't advocate for doing everything that YouTube does or shows you how to do. It is important to remember, even in these 3 videos you see here, these are all physicians teaching physician level skills. So, be mindful that there are limits. You can't just, you're not building a deck, and if you make a mistake, it's not that big of a deal. It's someone's life. So again, common risks, we talked a little bit about that. WEM journal, Wilderness Emergency Medicine Journal.org, is my site for looking at sailing injury statistics. Some of the kit contents, there's a lot of different spreadsheets. One of the main things people ask for is give me a list, and it's almost impossible to get a list. Now, this is a MyMedic, the Boat Medic kit right here. it's got so much in here. I'm not going to go through each piece of equipment, but just in the spirit of the last slide, it's got a 4-channel vented chest seal. It has a nasopharyngeal airway. These are all pieces of equipment that you really need to know how to use. You need to know how to evaluate someone after you've used it, in case they developed a tension pneumothorax or something like that. All this stuff requires training, and training is not done on the internet in the medical space, because there's an involuntary sort of fear and reaction that is common. It's spike in heart rate, spike in respiratory rate. I mean, you can imagine if you did accidentally jive and someone gets hit, gets knocked out, or is having a seizure in the floor of the cockpit, it's going to be intense. It could be intimidating. So you have to practice that in real life in order to flush those feelings out and also work on strategies to mitigate it. Other things that you might find, this kit here is $200, and it's fantastic. It's got all sorts of great gear, and you can find fantastic kits all over the place. This one is an adventure medical kit. It has one of my favorite medical books, this Michael Jacobs Marine Medicine book. Likewise, it does a really good job of having information of what's in the kit with policies and procedures tacked onto the bags. I think that's a really important piece. Whatever the case is, it should be waterproof if in the maritime world. And it's generally broken down in these categories: wounds, orthopedic, life support, medications, and survival equipment. How much to pay? Well, that depends on how much money you have. So, I mean, this kit here is probably 30 to 50 bucks, even though it claims to be coastal. And I think that the offshore version is like 60. You can't put any weight on the nomenclature that they use to describe the kit. You do see relatively consistent supplies with different price points. And really a day sale kit is going to be running up to about $100 to $200. Once you get into the more larger offshore brands, you're getting duplicates of everything, and you're getting specialty equipment with every bump up in price point that you get. Again, that equipment you might not have any use for personally, but you need to remember to know that you don't know how to use a blood pressure cuff, so that when you are finding help, you can say, hey, we've got a blood pressure cuff, we've got a suture kit, we've got all these different things. Can you help us? So waterproof, a good friend of mine, Randall Reeves, was doing the figure 8 voyage, and he had his cabin swamped in the middle of the Indian Ocean. It broke a lot of his electronics that he used for rescue. And it's just another reminder to keep everything waterproofed. Now, first aid equipment, it can be well organized, well stocked, or it can be improvised. And so just from 1 year at sea, this is a trip I did down through the Panama Canal and then back up to the US. It was about 10,000 miles actually after all was said and done. And these are all, those are nails in my family. My wife's fingers in the middle, that's a teak deck. I got stitches twice in my feet on the trip. There was a whole ton of crew on board that came between my family. We had everything. We had to be prepared for things that we had no idea on what to do. And that kind of goes back to having this first aid kit well stocked. If you can get a telemedicine service to support it, if you can get prescription medications to support it, and you take the appropriate trainings, you know what you have, now you have a fighting chance. It's when you don't have anything, but you think that the first aid kit that's 10 to 15 to 20 years old has the answers to your problems. It doesn't. So you got to have all these factors: training, equipment, prescription, medications, telemedicine, and that is where you want to be. I won't go into this. I think my time is mostly squandered, but that is a sinking boat. I was lucky enough to take about 1,000 miles. Different first aid kit on that boat. Unless there's any questions or comments, I am happy to pass the floor over. I believe it was Benjamin. Jack.
Okay, I'm going to take the floor. I'm going to take the floor back for just a moment, and thank you very much for a great. I wish we had everybody for an hour, and maybe that's what we should do in future sessions. So this is just little tastes, but I want to give you one more minute because I want you to talk to us about the program that Dave participated in, and what Dave is our sponsor guy, and he did a backcountry course. Tell us in like a minute everything you do.
Sure. Yeah. So with Maritime Medical Guides, we have programs that we have an online program. So you can log into an online program and you can click through and get, videos on all of this stuff that we filmed at sea and on the water, as well as 1-day, 2-day, and flotilla programs. So we have everything up to wilderness first responder. And really it takes the traditional curriculums and adapts it to situations that are more common for mariners, particularly sailors, and puts it into context. Doing a class at the Red Cross is great, but to extrapolate that information and use it on a boat is hard. It takes effort. But to take it on a boat and practice in the confines of a cockpit or in a cabin, and with all the idiosyncrasies of practicing medicine aboard, that's hard, and it's really empowering to learn, and it's easy to extrapolate that and put it in other facets of your life. So that's what we do, and yeah, we're really excited to get some programs going out east. We'd love some suggestions. If there's any harbors or clubs or groups that want to get some together, we'd be happy to meet you out there.
And Dave, our sponsor coordinator, is working with you towards that. So, and Dave took the course and had unbelievably great things to say about how valuable it was. So people have on their lists now safety at sea courses and John's courses. So these are great strides. So thank you very much. We're going to move on to Benjamin Jack. Dr. Jack is founder and CEO of Duration Health, an emergency medicine provider, and he's an ER doc, I believe. So take it away.
Hi, everyone. Thanks so much for having me. Bennett, thanks for inviting me and the rest of the group. John, thanks for that great talk. And it's great to see some old friends here as well. So I am an emergency physician. I'm founder and CEO of Duration Health. We sell off-grid medical kits for this exact kind of situation. People who are going off the grid, and obviously to places where normal medical care is not readily accessible. I want to tell you a little bit about our offering, and then also speak generally about the kind of preparation that you might need and how we can kind of fit into that overall picture. So let me just share my screen here. Are you able to see my screen? Great.
Yes.
So this is our website, just to kind of give you an introduction to what we do. So we essentially have this off-grid medical kit with antibiotics, EpiPen, other emergency prescriptions, where you talk with one of our doctors online. We review your medical history, and then our doctors actually prescribe the medications that you might need for you as an individual, and also where you're going and what you're going to be doing with the kit. And then we dispense everything into that custom kit for you and ship it to your door. This is kind of what a typical kit looks like here, with a handful of prescription medications, and then also over-the-counter medications we include too. And again, the idea is to kind of equip you as an individual based on your medical history and your needs for the various things that might come up for whatever activities you're undertaking. So to talk a little bit about specifically kind of with respect, obviously, to a maritime environment, and John already touched on so many of these things, but common things being common, we think about strains and repetitive stress injuries, as John said. The thing that's going to be the most common and get you is hurting your leg, that kind of soft tissue injury, and not as commonly the more serious issues that you might run into. Seasickness, obviously very common. Sunburn, cuts and bruises, fiberglass burns. If you're coming into contact with those sorts of materials. Hypothermia and heat stroke both can be issues in a maritime environment. And eye and outer ear infections, the outer ear or otitis externa being more common than an inner ear infection. So, with respect to duration health and kind of what we would provide, or if you came to us and said, well, what could we include in a med kit based on, I'm going out on this particular expedition on a boat for so many weeks or months. To take a couple of those as examples, some of them can be treated effectively with over-the-counter items, but some of them can be treated more effectively in some circumstances with prescription medication. So for example, scopolamine is a patch that's worn behind your ear that can treat motion sickness or prevent motion sickness. Ondansetron or Zofran is a medication that dissolves under the tongue that treats nausea and vomiting. So both can be useful in the treatment of seasickness or motion sickness. Antibiotics, obviously everybody always asks about. Systemic infections that require oral antibiotics are not the most common thing that you will run into, but those types of infections do happen, and it can be useful to have those antibiotics on hand. Certain antibiotics are preferred for infections that occur after an exposure to water, just because certain bacteria favor that kind of environment and are more likely to be causing the infection than other types of bacteria. So some of the antibiotics that we rely on in a water exposure kind of environment are ciprofloxacin or Cipro, levofloxacin or Levaquin, and doxycycline. And I can talk more about those as well. And again, these are all examples of things that we would include in a duration health kit. Eye infections and corneal abrasions, erythromycin eye ointment is something that we rely on for that. And ofloxacin ear drops for swimmer's ear or otitis externa. So, the way that our particular approach is constructed, I'm not necessarily recommending you have every one of these things in your kit. Some of them are better choices for certain people than others. But the beauty of our approach is that you actually talk with one of our doctors one-on-one in a live consultation, and then we figure out what would be most appropriate for you, and that's what's going to go in your kit. As you saw in that first landing page that I sent you, we have a promotion running for you guys, so definitely use that coupon code if you end up purchasing a kit. And I'll stop there and answer any questions and can talk more about our process or more specifically what kind of recommendations we think about.
Okay, let me get back in here and we'll probably come back to you on one or two of these things that you presented. The antibiotics we went over about a month ago with our speaker, another ER doc, and a friend of mine who has has his take on 6. I think I even shared with you 6 or 7 antibiotics. So the question is, do you need them all? Do you need some of them? And then coordinating it with how you implement using them is a big trick too. So we're going to touch base at the end and answer people's questions, because I'll bet there's a lot of burning questions that people have about that. So I will ask you for another 1 minute. Can you speak to COVID? And can you speak to, we spoke about it, you and I promised you I was going to feed you that question in 30 seconds or less. Tell us everything we should know about COVID, including whether or not someone should ask their private doc for medications that might be available, because this is a real topic, as it turns out.
Absolutely. So a couple of excellent points you bring up. So one, your private doctor, your personal doctor is always an option to get these medications or any medication. And again, we're just providing one option to get those. As far as COVID specifically, people have asked us about Paxlovid. Is that something that we are including in our kits? Because it's still under an FDA emergency use authorization and has not been formally approved by the FDA, we are not prescribing it right now on a prophylactic basis. If you can, again, talk with your primary doctor, maybe that would be something that they would consider doing for you. But Duration Health as a policy is not going down that road yet. We focus more on the treatment, commonly and widely accepted treatments for common things. You know, if you cut your skin, have an infection, most people can agree on, you know, whether it's one antibiotic or choosing from a few that you might use to treat something like that. And we focus on those, you know, very widely accepted treatments rather than experimental treatments.
Sure, excellent response. And also, as you know, this is becoming for us a common theme, and maybe even more common in the sense that when we first started in May of 2020, launching our response to COVID, when we had so few tools, and in retrospect, it was not as pervasive, but now it's so pervasive. There may be a lower death rate and less need for emergency room and hospitalization, but we know from people's experience that on passage, it can really be life-threatening because you've got your whole crew out of action. So I'm particularly sensitive to that. I have been all along since COVID, you know, hit us, from the point of view of people going offshore and what they need to do, what extra things they need to do. And we've been pretty good about that, trying to give people information and policies since the beginning. So again, Dr. Jack, thank you so much. We'll probably be getting questions to you. Let's go on, if we could, to Adam Rutenberg is Department of Emergency Medicine doc, and is going to talk to us about telemedicine and what a telemedicine program can provide to us.
Thanks, Bennett. So before we proceed, can I ask you to add me as a host, or else enable screen sharing? While you're doing that, I'll just tell a quick story. I think everyone who's a cruiser and probably everyone who's an emergency physician knows that you'll often find yourself in positions or situations where you sort of have to adapt to what's going on. So I'm sitting here in suburban Maryland, and halfway through the first presenter, a huge squall whipped up and my power went out. So I had to quickly rejoin from a laptop connected to a cell phone. So I'm going to leave my camera off because I'm actually sitting in a dark room, but it still says host disabled participant screen sharing.
Okay, I tell you what, Barb, are you there? Are you able to re-up his status, or Alex?
Or else just enable screen sharing.
All right, we're going to work in the background. We'll give it maybe 30 seconds. And then what we could do is we can lateral to Ursula and then come back to you if it doesn't work. Alex or Barb,
Hey,
are
Bennett,
you guys there?
there you go. You got it.
I've got it.
Oh,
Thanks.
perfect. Thank you, guys. All right, Adam, you're on.
All right. So can everyone see my screen okay?
Yep.
Great. So I'm Dr. Adam Rutenberg. I'm an emergency medicine physician at George Washington University in Washington, D.C. And some of this actually is going to be, maybe some information but some of it hopefully will be some information that's new to you. I'm going to talk a little bit about what telemedicine is and about our program and how we work and how best to interact with us. So, first, I just want to say, who am I? I'm a board certified emergency medicine physician at the George Washington University. I also work at the VA Medical Center in Washington, D.C., which we contract out to. I've been heavily involved in the telemedicine programs that we have at George Washington University, and I'm the quality improvement director of our Maritime Medical Access Program. I also always like to put a plug in here. So this is me up on the yard here. I grew up on the East Coast and started sailing sunfish when I was probably about 6 or 7, and have worked my way up over the years. And before I was a doctor, have spent time sailing on tall ships and really enjoy it. So who are we? So GW Maritime Medical Access is a program of the emergency department, the Department of Emergency Medicine at George Washington University. We were founded in 1989, and we are a dedicated group of physicians who provide 24/7, 365-day-a-year medical advice to primarily ships at sea. And, we cover everything from the small cruiser, 27 feet, 30 feet, 40 feet, all the way up through large cargo vessels. Our clients include shipping, fishing boats, research, food production, recreational boats. And then we've also expanded a little bit into aviation. We cover business aviation for in-flight emergencies. And we also do some remote telemedicine for land-based research stations too. So we have covered groups doing research in Antarctica, for example, who need ready access to telemedicine. So we are all board certified practicing academic emergency medicine physicians. So when you get in contact with us, the people that you're calling are essentially on their days off from working in the emergency department, but are providing dedicated on-call coverage to this service. And we basically provide medical, logistical, and operational support to our clients. I'll jump into that in a second, but why do we do this? Just thinking back through some of the other presentations that we have here today, it's important to know who's on your vessel, what equipment you have on your vessel, what drugs you have on your vessel, and also what your capabilities are on your vessel. But sometimes the knowledge and the capabilities that you need might exceed the knowledge and the capabilities that you have. And that's where we come in. This is when individuals need direct consultation with an emergency medicine physician. And in some cases, we will even get subspecialty consultation from, any of the other medical specialties that are, at the university hospital, and they're all available 24/7. So this is a bit of a reiteration, but I always like to make this point. So what's important before you go on your voyage? So just like anything else, as has already been touched upon, preparation is really critical to have a successful, journey. The key to managing a medical emergency is really to plan not to have a medical emergency, whether that be, keeping safety equipment on board, taking extra care to make sure that somebody is not injured, making sure that people with certain chronic medical conditions either have them well managed or are not aboard. These are all very important things. And so, the first point that I just like to make is that in preparation for your voyage, you should go see your own doctor. When you see your doctor, you want to discuss the nature of your voyage. Now, not every physician has an understanding of what it means to be offshore, but hopefully your own physician will know you and know your medical problems, and you can have a frank discussion about how long you're going to be offshore, how far you might be from care, what specific medicines or medical equipment you as an individual or the people on your boat might need. So you discuss the nature of your voyage, get a physical, any lab work, make sure you're up to date on vaccines. And I've put this in there thinking about COVID-19. That's become very important, even though it does seem that there are a lot of breakthrough infections amongst those who are vaccinated. The outcomes are much, much better. Get a baseline EKG and have it with you. Make sure to do a medication reconciliation. In other words, go over your medications with your physician. Make sure that you're on the medications you need to be on and not on the medications that you don't need to be on, because medications have side effects. And make sure that you get appropriate refills for the duration of the time that you're going to be at sea. And then plus any other potential time that may be due to delays or difficulty entering a country to get a refill if necessary. And then really critically important, this is the time to get that rash or lump or other nagging issue checked out. If you get something has been bothering you, if you get it checked out, it's going to be nothing, and you'll go to sea. But if you don't get it checked out, invariably it will turn out to be something that you don't want to have when you're far from medical care. The other thing that's important is to know who's on your boat. And this was touched upon before, but this is really critically important. You may be sailing with friends, you may be sailing with acquaintances, you don't know that well. People may not necessarily want to share things, but everyone should have a medical summary on board. It can be kept confidential. It can be kept in a sealed envelope, laminated so that it's waterproof, but available so that if it's necessary, the captain or whoever is making communication with us is able to quickly get at your medical history and understand what your background is. And it's important that this be written down and kept somewhere where everyone knows where it is, because not every individuals are not able to communicate readily themselves in every medical emergency. It really depends on the situation. This should have your name, date of birth, the list of physicians who care for you, list of your medical problems, prior surgeries or other medical procedures, what medications are being taken regularly, and then whether you have any allergies, both to medications as well as environmental allergies, because that can come up. And then keep a copy of that EKG. I think that if there's one document, in addition to the history that we always wish we would have, it's a copy of the EKG. This may be more true on some of the bigger vessels that we cover, where we're actually able to get an EKG and have it transmitted to us, but we can get a lot of information from that historical EKG. The other thing is that we provide shoreside case management. And so if you find yourself in a hospital or medical facility, while you're traveling and you get that EKG, we always want to be able to compare it to an old one. So telemedicine, what, where, why, how, who, and when. So, there's really not enough time here to talk broadly about what telemedicine is. There's a pretty broad definition of telemedicine, and it can mean a lot of different things to a lot of people. But for our purposes, really, telemedicine is remote medical consultation, and this can occur anywhere you are. And the reason is that this brings assistance to you. It brings expertise to the boat that you may not necessarily have, or expertise that maybe is peripherally held by someone on your boat, but who isn't exactly the right person to help with the specific issue that you have. So, Bennett mentioned he's a radiologist. He might not know what antibiotic to prescribe for your infection, but all doctors always sometimes need help. So, when I order the CAT scan of the head or the abdomen at 2 a.m. in the emergency department, I need someone like him to help me read that CAT scan. And you might be out there with a doctor who's a primary care doctor, or who's a psychiatrist, or really pick a specialty, who might not necessarily have that expertise. Whereas our emergency medicine physicians really have that broad-based background to be able to evaluate a variety of different types of situations and sort of narrow down what might be going on and help develop a treatment plan. And all of our physicians have experience in maritime aviation and austere medicine, which is to say, they either have a personal interest in this kind of medicine or a professional background. Our medical director actually was in the Coast Guard prior to becoming a physician, and have been doing this for a number of years. And so we have seen just about anything that you can think of. We'll get calls and emails at all hours of the day. We can provide advice and assistance. We can walk you through what antibiotic to take or how to dress a wound, and all the way up to draining an abscess, or we've talked people through putting stitches in over video chat countless times, and even other much more complicated procedures like putting in a Foley or even a chest tube. So the question is when. So when should I call? In other words, when is someone sick enough? And there are a couple of simple rules that we live by. Really, the key is call early and call often, which is my third bullet point there. There's no issue too small. And we have unfortunately seen scenarios where people call with a medical problem, and we'll start getting the history, and it turns out that it's something that's been going on for 3 days, 4 days, 5 days. And things, when you're offshore, when you're in a rolling sea and a hot environment, may be clean, may not be clean. Minor medical issues can turn into major medical issues quickly. And our goal here is to address things while they're small and take care of them before they present a big problem for you. So really, does what you're doing, is somebody a little sick? Does it make you nervous? Is there some minor concern? Or does it impact the mission? If you're sailing with yourself and 1 or 2 other people on board, and an illness amongst one of them might really create a challenge for safe manning of your boat, then call early, call us often. Once we open a case, you can call whenever you need, and we set up a communication schedule. So we do follow-ups. The way our service, I'm going to come back to this, but the way our service works is you initiate contact with our communication center, which is staffed 24/7 by EMTs. They'll get a little bit of background information, and then a physician will join the call, usually within less than 2 minutes, and do a direct consultation with you. And this can be done over phone. It can be done over Zoom. We support a variety of telemedicine kits as well that allow video and other telemetry data to be transmitted. And then we'll make a treatment plan and we'll review it with you. We'll set up a follow-up schedule so that, if we're not seeing the expected outcome based on our treatment plan, we can shift that treatment plan, and we follow a case basically until it resolves. And we consider resolve to be either the medical issue has been, fully addressed and the individual's back to health, or they're off the boat and ashore, and care has been transitioned to a more definitive facility. As I said, in that bottom blue box, we have 52 medical specialties, with just about every subspecialty available for consultation as well. And there are times where we will see a case that we know can't be addressed on board, and so we'll work. We'll actually do a review. We never recommend an evacuation or a diversion without first having a consultation with at least 2 of our doctors, and often it will be 3 or 4 or 5, and we'll get on a conference call at pretty much any hour and discuss the case and decide whether we think we need to arrange an evacuation. Usually when it comes to evacuations, the captain is in charge and will make the final decision, and usually we'll be communicating with the Coast Guard, but we're absolutely available to get on with them as well. And this is worldwide, and communicate with, whether it be the US Coast Guard or another evacuating authority in another country, and provide information as necessary. We actually do a surprising amount of our work via just email. And the reason for that is because not every small boat has a satellite phone. There are bandwidth issues with video calls and even with voice calls when people are offshore. Whenever you open a case with us, so these are important things to know. We're always going to want to know your what vessel you are, what your location is, what your time to port is, and what your closest port is. Sometimes we will make recommendations to go to one port versus another because of our past experience or knowledge of the medical care that might be available in a particular location. We're going to want to know the patient's name, the patient's date of birth, and then we're going to want to know their medical history. And that goes back to that medical summary I mentioned. You want to be able to just pull that laminated card out of an envelope and have it all right there. We're going to want to know vital signs. We're going to want to know what happened. And then we're going to ask you to be prepared to answer questions. And we might ask you to go through a physical exam, which we'll guide you through. We might ask you to send us pictures. And we really want everybody to know their onboard equipment and what medical training they have on board in advance of when they call us. Now, I always say, if there's an emergency situation, think of the patient first, use whatever training you have to go through your airway, breathing, circulation, stop any bleeding, address any life-threatening issues, and then try to triage the situation. If it's a true life, limb, or sight-threatening emergency and you have the resources, you should dedicate one person to call us and communicate, while another focuses on taking care of the patient. However, if it's something minor, if it's something mild, take the time, and that's frankly most cases, but take the time to gather all of this information and be prepared for the call. No one should ever be nervous when they call us. We know that we're working sometimes with people who have zero medical training. Sometimes we might be speaking with another physician, and we will adapt based on the onboard knowledge and do our best to really communicate with you in layman's terms and walk you through things and take the time and be patient. And that's what we do. So in conclusion, prepare, communicate early, communicate often. And now I think, we'll have some time for some questions at the end here.
That's tremendous. Thank you so much, Adam. And so there are some questions that have popped up along the way. We're going to address every one of them at the end. But one came up, and I told Adam we weren't going to really tackle this this session, and that's can you give some estimates regarding cost of the GW program? But I imagine that Jay is not the only person who is asking that. So I'm going to give you the answer that for this session and tell you that stay tuned because we're talking, we're negotiating, we are coming up with the best plan that works for us. So there's all different flavors of fee structures, right? It's like insurance, and there's per click models on this where it's by the phone call or by the problem. It could be by the boat. It could be by the rally. It could be by the year. So I'm going to tell you that we have come up with some solutions that are reasonably priced. A boat for a rally at around $100 for the boat is something we've been talking about. I hope I'm quoting myself right. It's been a while since I looked at our correspondences on that. We've talked about a season at around $700 for a boat. So for me, I think that's a very reasonable price for what MMA is offering. So that having been said, we haven't finalized these things, and we may decide we'll go with a whole rally approach where we're going to cover the whole rally. It's required in the, I think, Marion to Bermuda. Do you guys do Marion to Bermuda, Adam?
Yeah, we do. We do.
Yeah. So
We have in the past.
and there's a Pacific race, I think you do, right?
Correct. Yeah.
So they're covered. They're required to have coverage, and it's brilliant. So I'd like to think that maybe we can accomplish that. So stay tuned. So all the rest of the questions, I'm going to just ask that we hold. And let's go ahead and get Ursula into the mix. And Ursula is going to talk to us about DanBoater and repatriation in particular.
Well, thank you, Bennett. I appreciate you inviting me today. Happy to share what I have here. I'm going to see if I can share my screen. Let's see here. Okay, can you see my screen?
We do.
Okay, excellent. Well, I have to say, this is a stellar panel of presenters today. You guys have just knocked it out of the park, all of you. So I am delighted to be here. Let me explain a little bit about DanBoater and our history. Dan, for those of you who are not scuba divers, is Divers Alert Network. We have been assisting scuba divers globally for over 40 years now, literally plucking them out of the middle of nowhere, assisting them when they get into trouble, finding chambers to put them in, getting them to hospitals, getting them evacuated, getting them repatriated. We have done it all. And one of the things that we discovered about 10 years ago is we found out that not insignificant number of our members were not scuba divers. And we couldn't quite figure out why that was, because they were paying for membership and dive accident insurance, yet they would never use, 2/3 of what was in those plans. So we started taking surveys and talking to our members and trying to find out why were they joining us. We have an Alert Diver magazine that everybody loves. So it wasn't just the magazine. It turns out that these folks were long distance cruisers and sailors, folks that go up and down the coast. They literally go around the world tours. They're down in the Caribbean. They're over in Asia. And they were interested in our 24/7 emergency hotline, our medical evacuation, medical repatriation services. So we went back to the drawing board and we came up with a membership product that included the things that they wanted. And that's where DanBoater came from. So DanBoater has actually been in existence as its own standalone program for about 6 years, going on 7 years now. And basically what we do is we don't provide the telemedicine, but we have our 24/7 emergency hotline, which is manned by medics and physicians. We also have a global network of physicians, emergency departments, hospitals that we work with all around the world. So whenever you run into trouble, you can call us, talk to one of the medics, talk to one of the physicians. They'll triage what's going on with you, try to figure out what kind of resources that you need, what resources are available where you are. Talk you through that, let you know what your options are. And then if you need to be medically evacuated, we need to get you to a hospital or we need to get you to a physician. We already know what the resources are that are available in your area. We call ahead, we make all the arrangements, we get you where you need to be, and then we cover the cost of that transportation and getting you there. That could be by boat, it could be by panga, it could be calling the Coast Guard, it could be calling an ambulance. The program, it's not limited though just to boating. It's anytime you travel more than 50 miles from home, these services are available to you. So in most cases, the call to the emergency hotline, our guys can walk you through, what's going on. We can explain to you how to use what's in your first aid kit. We can get in contact with your private physician and talk to them and find out what you need. It's not uncommon to be out in the middle of the ocean and whoops, there goes the heart medication overboard. We can call ahead, work with your physician to get that refilled and have it waiting for you when you pull into port, that kind of thing. But in the instance that you do need a medical evacuation, like I said, our guys are ready, willing, and more than able to make all of those arrangements and get you where you need to go. And we monitor you throughout the entire process. So we serve sort of as the glue between your personal physicians, your family members, the physicians on the ground, where you're going, where you are. And then in most cases where there's a medical evacuation, the medical facility that we get you to, they're able to take care of what's going on with you, get you patched up, prescriptions set up, and then you go back to your boat and you go on about your vacation or your cruise or whatever, and everything's fine. However, there are some cases where the only medical facility or the only medical resources available to you where you are or close to where you are just aren't sufficient. They're not equipped to handle what you need, or perhaps the one cardiologist on that island is on vacation for a month and there's no one there to help you. In those cases, that's when the medical repatriation kicks in. So again, with the medical repatriation, the way it works is as long as you're stable enough to be transported safely, we will call ahead, we will make all of the arrangements, and then we will transport you to the hospital of your choice in your home country. So you're not required to go just to the closest hospital. You're not required to go just to certain hospitals. You get to choose which hospital you go to in your home country. And then we cover the cost of that transportation and getting you there. And that includes things like having a nurse along with you, having medical supplies along with you, oxygen. Most of the time, though, repatriations, it basically involves purchasing airline tickets and making sure you've got plenty of seat space and plenty of leg space. If you're in a cast or in a wheelchair and need space, you need special oxygen. Do you have to fly at a certain level and that kind of thing? So our team is extremely skilled in these areas, and they've done a phenomenal job for over 40 years. I'm really, really proud of them. But in addition to those things, and I realize that those are the three primary benefits that Salty Dog members are looking for. But I just wanted to touch on real quick some of the other things that are included in the membership. We also have search and rescue expense coverage. Now, as all of you know, search and rescue is not free everywhere in the world. And even here in the US, when you're traveling, there are certain states that require you to have search and rescue expense insurance coverage. If you want to go hiking, I can't remember which state it is off the top of my head, but you're not even allowed to go hiking in that state unless you can prove you've got coverage. So we cover the cost of the up to a certain amount. $25,000, I believe, is the benefit limit for search and rescue. So we will pay that if the search and rescue provider requires you to pay. We also offer several travel health and safety resources. Let me scroll down real quick. Here we go. Our physicians on staff, they've written several quick practical first aid and travel planning guides. Two of the most popular are Hazardous Marine Life Injuries Guide and Musculoskeletal Injuries Guide. And then interestingly enough, the Travel Related Disorders Guide, we've had a phenomenal interest in that, uptick in interest in that here lately. That covers things like DVT, hypothermia, high altitude sickness, that kind of thing. So it sounds like the international travel and adventure travel industry is starting to pick back up, it sounds like. So these things are actually flying off the shelf. You can buy the hard copy versions like you see here in the photo, but they're also available online for free on our website, danboater.org. We also have a Safe Passage e-newsletter. And then down here, this is on danboater.org. We get into some details about the medical evacuation and repatriation. And some of the other things that I wanted to cover. We also cover things a lot of people don't think about. So let's say you're traveling with kids or your grandkids, and you get injured and someone needs to take care of your kids, and you're in the hospital and you can't take care of them. Your DanBoater membership will also cover the cost of returning your dependent children home. We make all the arrangements and we cover the cost of that. We'll also make arrangements and cover the cost of having a family member or friend come to stay with you if you're hospitalized and you need assistance. And if you're traveling with friends, perhaps on a cruise, and the cruise becomes interrupted because someone became, really sick or injured and had to be hospitalized, we will make arrangements to return your traveling companions home as well, and we cover all the costs of that. And then rental car, return rental car, medical expense advances, prescription assistance. Like I said, we work with your private physicians to get your prescriptions refilled. Throughout every single case that we do, we're constantly doing medical monitoring. So we stay in constant contact with you, your family members, your friends, the medical facility that you may be in, the physicians that are treating you, your physician back home. So we maintain constant communication just to make sure you have everything you need. We try to stay ahead of things. So if it looks like something is going to become more serious, or you're going to need additional follow-up care or rehabilitation care, that kind of thing, we stay in contact with you and then try to stay ahead of it so that you have everything you need when you get back home for that follow-up care. We also offer translator and foreign services assistance, emergency message transmission, lost and stolen property recovery, travel service assistance, legal assistance and referrals, that kind of thing. Things that you would normally see in traditional travel insurance. That's all included in your membership. And then the final question everyone asks is, what does this cost? A DanBoater membership for an individual is $60 a year. And for a family, it's $100 a year. And that includes all of these benefits, all of these coverages. And then the very last question I get asked is, what's the catch? Because the price is so inexpensive. The catch is we have over 250,000 members. So, so we're able to do this. We are a not-for-profit. We're not in this to make $1 bazillion. We're not your traditional insurance company. We're here to help you. We're here to, make sure that you're safe. So I highly encourage you guys, if you have questions, let me know. All of the details down in the weeds, the individual coverages, that kind of thing, it's all available on our website at danboater.org. And that would be my presentation.
That's great. Thank you, Ursula. So a couple of things that I'll follow up with you on, and then we're going to open it up to the other questions that have popped up. So, all of the presenters today represent companies that have what we have seen to be really robust products and reasonably priced products. And there are nuances to what everybody offers, the levels and the thing that struck me from the very beginning about the Dan program, Ursula, touched on here. This is a very reasonably priced program for what you get, and we've already had a relationship for 2 years with DanBoater. There is a landing page that our website launches you to. They've been good enough to provide some discounting to us, and this is exciting to us because all of these services that we've heard from today are really interested helping us and dealing with us. So thanks again to everybody. A question arose. How are DanBoater and DanDiver different? I think he's talking about it with respect to himself. If he's a DanDiver member, does he need DanBoater membership?
We get that question a lot. No, you do not. If you are a current DanDive member and you're carrying the DanDive accident insurance, you already have everything that's in DanBoater and then some, because your dive accident insurance actually covers the medical cost, the actual treatment itself, the doctor's visits, the hospital, that kind of thing. DanBoater doesn't cover the medical cost. It's not traditional insurance. So you don't need both.
Excellent. Okay, that's a great question. Great answer. All right, I'm going to just page back up to the top of the questions, and people can feel free to shoot other questions by using the chat. So let's see where we're at here. How often do you have to renew the drugs in these kits, especially if they've not been used? Perhaps Benjamin, are you still there?
I am, yes. So for a duration health kit, so we say explicitly that the expiration date is 1 year on all of the medications that we dispense. Some of them are longer than that, but by and large, it's a year. There's obviously controversy. Could the medication be used longer than a year? What happens if you use it longer than that? We, as a matter of policy, again, and by pharmacy regulation, it's a year once your name gets put on that vial.
Okay, that's a fair answer. On the other side of the coin is that I didn't just leave those medicines in my bag that you saw at the beginning of the talk for 5 years, because you can extend a lot of these, but it's true, a year is the standard. And so if you want to be, if you want the medicine to work, you got to know that eventually the medicines will stop working, or will, Dr. Jack, will they hurt you?
So it depends on the medication. There are certain medications that have traditionally been thought of as becoming toxic after expiration. One of them is doxycycline, actually, which we commonly include in medical kits. If you look at a typical medical textbook, it'll tell you that doxycycline can damage your kidneys after it expires, but there's actually some research showing that that's not true at all. So the jury is out really on, how long you can use a lot of these medications safely.
Yeah. Okay. That's great. I really appreciate that. Let's see, where are we at here? Sorry. We have a lot of questions. Thoughts on AEDs? I'll answer that. We briefly covered that last session, but I would encourage anybody to jump in and disagree. But we talked last session and previously about AEDs on passage. That's really tough to justify because it's an expensive piece of equipment and you don't have EMS. So if you have an MI, if you have a heart attack and some arrhythmia that's because of the cardiac event, you need to be immediately transported after you're, shocked. You need to have access to EMS. So in the middle of the ocean, chances of surviving this event are really pretty low, unfortunately. Now, that's different than when you're at shore. When you're in port and you're the only guy around with an AED, that may save someone's life, but you have to weigh that against, they're not cheap. They're less expensive than they have been, and certainly they're marketed to people like us or anybody for that matter. But that's the way I see it. Anybody else want to jump in?
Hey, Bennett, it's Adam, Dr. Rutenberg. I tend to agree with you that on a smaller boat, the cost usually doesn't justify the carriage of an AED for exactly the reason that you outlined. If you have a cardiac arrest, the two things that have been shown to have the most benefit are, high quality compressions and then early defibrillation for for an arrhythmia that's amenable to defibrillation, which not all of them are, and the AED will help make decisions for you. But the need to get to, it's not like in the movies, you don't just shock someone and then they wake up. The need to get to definitive care is there, and it's true and it's strong. I think that if in an emergency situation, it does not hurt to have one, but if you have limited funds for if you have limited funds for carrying medical equipment on board, carrying medications on board, it's probably not the thing that is going to be most likely to be needed, nor is it the thing that's going to be most likely to lead to a better outcome, in that unfortunate situation of the cardiac arrest. So, the jury is out on that, but it's probably not the most valuable thing to have on board.
Okay, great. Thank you. Renewing drugs we talked about, so I'll skip that one. Can one arrange crew interviews for a ship's RX kit? Dave, are you there? Do you want to elaborate on that? Because I'm not sure what if you're there, tell me more about what you're asking.
Hey, Bennett. Yeah, I am. Can you hear me?
Yeah.
Yeah. So the thought is that, the talk was really individualized, but if you're the skipper and you're preparing for the safety and well-being of your entire crew, how can you kind of manage that before you launch?
Sure. So if you're asking, from our setup in particular, each of our kits are prescribed to an individual. So there is no, off the shelf kit for the ship, for example. We need to talk to each individual person, but we can do that. So if you shoot us an email and say, I'm preparing for a voyage with X number of people, we can arrange, each of those people to come through our process without each of them having to put in their credit card. We can kind of take care of all of that for you.
Perfect.
Yeah, that's awesome. Also I mentioned that in the very beginning, that it's part of the checklist of having your crew check in with their own docs on this. So it's not just you as the captain, but each crew member needs to do that same exact thing, even if it's not through Dr. Jack, or even if you are or not going to have Dr. Rutenberg. You need to know the meds that you're going to have on board. Otherwise, how is Adam going to tell you to take it if you don't have it? So, I'll share a quick story. This is something that happened last year, I believe it was, or 2 years ago. So there's an incident that occurred in one of our rallies. A guy on immunosuppressives, transplant patient. Somehow the meds either got flushed down the toilet, went overboard. I don't know the story, I only heard third hand. But all of a sudden, no immunosuppressants and many days to go. What does he do? So there was a lot of agita created by that event. And really, our shoreside jumped in. I heard all this after the fact. Shoreside jumped in. Their doctor jumped in. A lot of different opinions from a lot of smart people. And in the end, maybe had MMA been involved, they could have used the steroids that they were carrying as a bridge. Instead, there was a very valiant effort that involved, I believe, the Coast Guard dropped whatever immunosuppressant the guy needed. For those that know the story better than I, forgive me, I probably left out some details that make this a more coherent thing. But the point is that, we're trying to solidify this approach so that even the craziest kind of event that could occur, MMA or DanBoater, or maybe something you learned from one of John's courses, can really help to bridge this, and these stories will become less exciting. So that's my 2 cents on that. How are meds which are temperature sensitive handled in your kits? I guess that's Dr. Jack again. There really aren't any, I guess, are correct?
Right. The medications in the kit are meant to be stored at room temperature.
Right. So if you have specialty meds, hopefully you have an ice chest or a refrigerator on your boat, and that should handle that. And be careful not to have these things frozen, because there's some meds that shouldn't be frozen if they're not meant to be frozen. That is that one. Estimate of cost we talked about. Shelf life for drugs is significantly shortened by moisture on the yacht. Do you recommend vacuum sealing drugs on board?
Yeah, again, if you have the means and the time to do it, it might extend the life of the medications. If you don't have the means or time to do it, it's difficult to say, what impact that would have. Again, these are pretty standard medications that are, typically stored on a shelf in a bathroom. So, I don't
Right.
think it's essential.
Excellent. Does it make sense to share crew medical histories and other known items with George Washington MMA before the trip? Yeah, tell us a little more, Adam, about how that goes. You
Sure.
get the histories ahead of time from everyone?
What we do is we register each boat and we'll get the medication list and we'll store the medication list in our database. Usually, actually, what we'll do is we'll store the medication list and medical equipment list. So we'll have a sense of what the capabilities are. What we don't do is collect individual medical histories prior to any patient contact. We cover, at any one time, we're covering a large number of boats and thousands of individuals who might be on these boats. And we don't like to pull in all of that personal medical information and store that in advance. We actually work the same way any other medical practice does, in that when we open a case and have a contact with you, we start a medical chart, and the medical information goes into the same chart that our shoreside medical practices use. So we, just as you wouldn't give your medical information to a physician's office prior to a first appointment with that physician's office, we don't start keeping information and storing information on individuals until they actually have contact with us for what you would sort of think of as a visit, an office visit, but of course it's not a traditional office visit.
Yeah. So it's interesting. I could, as we get a little more continuity of care and medical systems have access, as long as you're in the same system, there is some benefit to having sort of a full history and physical, I suppose. If you have one on your laptop and you've called as an emergency MMA consultation and a real emergency room visit through you guys, we could always, that's a really low bandwidth, very small piece of information that we could send as part of, one picture of the rash, or one, I don't know, do you ever get a rhythm strip sent from somebody's Apple Watch, or?
Absolutely, we certainly
Yeah,
do.
so those kinds of things can be sent to you in real time.
Yep. And our email system is HIPAA compliant. So we do like people to know that where it potentially falls out of HIPAA compliance is on the user side, on the patient side. So something that's running through our servers is HIPAA compliant, but depending on what your email address is and how that's routing through, it can be accessed on the sort of on the user side, but on our end everything's HIPAA compliant.
Yeah. Okay. Super. When do you consider the season? Is that for a year? Not sure in reference to which service we're talking about. So for MMA, we've been talking about the actual Caribbean season. So that would be, you cover for the passage, you cover for the time of the traditional passage home, and then you're covered for the time that you're also in the Caribbean. So you're talking like October 30th to May, whenever, again, we haven't really gone into the paperwork, but I promise that we're going to get there before this Caribbean rally. Alex, did you have that in mind? Or is there any other span that you were talking about?
Well, that was one option. And then maybe the other one is only because it sounds, certainly the MMA, the ability to call them anytime, even if you're off, on the coast, sometimes reaching out to a group that as opposed to just going into any old ER is something you'd prefer to do. So
yeah, that's the point, is that that when you're, so we didn't really talk about this, but when you're in the Caribbean, you have a lot of other choices. So for one thing, insurance, you pay out of pocket, you're paying less than the US. So many people don't have insurance when they're cruising. So they will go to the emergency room and they'll pay out of pocket. And, it is better in some places than others, but, I think Adam could talk to that. He alluded to the idea that they have expertise in knowing where to go for your specific problem. So if you're in Dominica, maybe that's not, I don't mean to single out Dominica, but yeah, if you're in the US, if you're in St. Thomas, that maybe is a little bit better, or not. I don't know, Adam.
Yeah, we'll start and run a case the same way every time, and if it can be managed on board, we'll manage it on board. If it needs shoreside care, or if you're not in a port and have options to go to different ports, we will talk about what the ideal port to go to is. Now, what we don't carry is information on every hospital and every port in the Caribbean. Nobody, there are databases out there, but none of them are complete. However, we do keep an internal database of every facility that we really have ever sent anyone to around the world. So we'll keep, names and contact information and what our experience with the facility is on file. So, we do refer to that when making shoreside referrals if necessary.
And back to the spirit of
DanBoater does the same.
Yeah. Thank you, Ursula. I didn't mean to, thanks. I appreciate that. And yeah, I mean, again, coming back to the Dan program, there's so many different components that DanBoater offers that this meshes very closely to the Dan mission. Back to the spirit of the question, it's the season in the Caribbean that would be covered by Dan, by MMA, and it's your choice for how you use it, or if you use it. So that's the answer to that, I think. DanBoater and Dan Diver we covered. How much does Dan Diver cost? Ursula?
Dan Dive membership by itself is actually the same now as DanBoater. They had a rate increase earlier this year. So it's, I believe it's $60 an individual and $100 for a family for the new enhanced membership program. And then the dive accident insurance, the cost of that varies from state to state and province to province, because that's true insurance product. And so it varies. Anywhere from, I think the least expensive I've seen is $73 to cover an individual for a year, the insurance part, up to a couple of $100s. So you'd have to go on the dan.org website to look at the price swing on that. But that's one of the things that I think boaters like so much about the DanBoater program. It's just one product. It's a membership product. So,
Awesome.
And plus, like I said before, most boaters are not scuba divers. I mean, they may have been former scuba divers, which is how we got a lot of the members in the first place. They're former divers, but they wanted to stay with Dan. They wanted to keep the regular service, but they no longer dive. They don't need the dive accident insurance. So, you don't have to have the insurance.
Right. Thank you. Last comment and the props to it is EpiPens, and yeah, we've been talking about that last session. Benjamin offers that in the kit, and it's a key part of anybody. EpiPen and EpiPen equivalents, because right now, I just went to renew my EpiPen at CVS, and even the sort of generic, less expensive one is out of pocket, which is frustrating, and it's not cheap, but it's kind of better than it was a little short while recently. All right.
Yes.
Yeah.
No, go ahead. I was going to say EpiPens, obviously can be life-saving in the right situation. And again, if you talk with one of our doctors, we can figure out if it makes sense for you to have that in your kit.
Okay, that's super. I'm going to turn it over to Alex, but before I do, thank you again, all the participants and everybody who signed in. Alex, parting words?
I just Bennett, want to thank you for arranging this really great panel. I think we've all learned a lot. This is excellent. I feel like we have some really excellent opportunities in terms of services that we can take advantage of. And I hope we don't need to use it, but I think it's very comforting to know that if you get the right kit and you've got the right person at the other end of the line, it has to make going on a cruise a lot more comfortable and safe for everybody. So again, thank you all very much. This has been just a great discussion. And I guess that's it. Oh, wait, and actually we had two more questions I think just popped up. We will replay this. The entire session is being recorded. So if you missed part of it, have no fear. You'll be able to, we'll be publishing it shortly and or as soon as we get it back from the cloud, and then you'll be able to see it. So with that, I'll turn it over to Barb and we'll wrap it up.
All right. Well, thank you, everyone. What a great presentation. And for sure, I will get that recording out to everyone because like Clark said, it is worth replaying. And on Thursday, hope to see you all here for our next webinar. We've got Skippers in Search of Crew, Crew in Search of Boats, hosted by Alex. So hope to see you then. Everyone have a good evening.